Conference, can I now ask Monica Lennon, Shadow Cabinet Secretary for Health and Sport, to open the debate. Monica.
Thank you, Chair. Good morning, Conference. It's a privilege to address you as Scottish Labour spokesperson for Health and Sport. Over 70 years since its creation, the NHS remains the defining symbol of Labour. Built on our values, served by the best staff in the world, the NHS has given us so much. Amazing work continues in our NHS, but all is not well. Too few GPs, staff exhausted, operations cancelled, Audit Scotland's warning of an unsustainable future, and a Scottish Government breaking the law on treatment times every single day. We can't run Scotland's NHS on Nicola Sturgeon's empty promises. So, Conference, the NHS needs a Scottish Labour Party as a force for real change. It took courage to build the NHS. With courage, we'll revive it, transforming health and social care for modern Scotland. The next election is a battle for the future of the NHS. And when we win that battle of ideas, we will call time on austerity and health inequalities. Because urgent change is needed. Overall life expectancy in Scotland has fallen for the first time in 35 years. And how can it be right that the richest Scots can expect good health for 20 years longer than the poorest? In government, we will be a champion for those without hope. We will draw inspiration from people like Gillian Murray from here in Dundee and her brave fight for an independent review of mental health services in Tayside. The death of her uncle, David Ramsay, to suicide is sadly all too familiar to other families across Scotland. Gillian is working with my constituent from Motherwell, Karen McKeown, to campaign for a national review of mental health services. Karen's partner Luke ended his life after repeatedly asking services for help. Gillian and Karen's campaign is now before the Scottish Parliament's Public Petitions Committee, and they have our full backing, don't they, Conference? Because suicide is preventable. No family in crisis should ever feel abandoned, and the pressure on the mental health of staff, overworked staff, must end too. And here in Dundee, Scotland's drug death crisis is at the highest rate in Europe. With drugs and alcohol ruining lives in every community, it is Scotland's public health emergency. My own much-loved dad died from decades of alcohol abuse. The emotional scars of addiction run deep, and families affected by the harm caused by alcohol or drugs misuse feel isolated. Investment in recovery is scant. We have to change this, and we will change this, Conference. Because over 50,000 young people in Scotland are affected by parental drinking. We will put support in place for these children and young people on the first day of a Scottish Labour government. And we will end the predatory industry practices that saturate our poorest communities with betting shops, booze and unhealthy food. We will activate the social responsibility levy on alcohol sales, potentially raising £100 million a year in Scotland. We will ban alcohol marketing to children. And as a former town planner, I'm proud to say our planning proposals will promote health, empower communities, give children the right to play, and we will invest in the sporting potential of Scotland's young people. Today, of course, we celebrate International Women's Day and feminism, and we will deliver health justice for women, starting with the mesh scandal and the brave mesh survivors who have been supported so tenaciously by our comrade Neil Findlay. We will ban these barbaric devices completely. And we will not rest until every woman has the opportunity to have access to full mesh removal. Conference, too often women's health needs are unmet. That's why in the budget backed by Engender and women's health charities, we called for a dedicated women's health fund. And in government, our women's health programme will close the growing gender health gap. We've led the charge against period poverty. When my members' bill passes, hopefully later this year, Scotland will be the first country in the world to introduce free universal access to period products. Because when it comes to ending inequality, there is no limit on our ambitions. That's why we will deliver on the promise of integrated health and social care through proper funding of local services to ensure no one is stuck in hospital longer than necessary. We will ensure fair work for all NHS and social care staff by investing in the workforce, giving them time to care, opportunities to progress, and tackling the spiralling costs of agency spending. In conference, the recent clinical waste scandal has exposed the worst excesses of privatisation in our NHS. I'm talking about Healthcare Environmental Services Limited, whose workers based both here in Dundee and in Shotts in Lanarkshire were abandoned at Christmas after that firm put our NHS at risk. So I urge SNP ministers, don't sit back and do nothing when workers who served our health service are pushed into poverty. Do the right thing and pay these men and women what they are owed. Because, Conference, we will always be on the side of the workers, and that is the difference a Scottish Labour can and will make. Conference, the best days of our NHS still lie ahead. Real change in our communities is possible. We will build a modern Scotland where our health is not reliant on our wealth. With a Scottish Labour government, that is what we will deliver.